Welcome to another edition of Disability and You. I'm Ganesh Singh. I'll be with you as usual for approximately 30 minutes. On this edition, my focus will be on prevention of blindness and caring of the eyes. Last Thursday, we observed World Sight Day 2024, which is observed every October on the second Thursday. This year, the theme that was coined by the World Health Organization is Children Love Your Eyes. With me to discuss the theme and more as it relates to services for children, not just children who are visually impaired, but children in general, as it relates to eye health, is Dr. Arlene Bob Semple, an ophthalmologist at the Georgetown Public Hospital, and Ms. Janelle Harry, who's an optometrist at the same institution. Dr. Bob Semple, Ms. Harry, welcome to Disability and You.
Thank you
for having us.
Excellent. Dr. Bob Semple, we'll start with you. I want us to deconstruct the theme a bit as it relates to children love your eyes. Why is it important for children to love their eyes?
All right, it's very important for children to love their eyes because children are the future generation. They're the leaders of tomorrow. So we as parents, guardians, and adults, also healthcare professionals, we have to encourage children to take care of their eyes, thereby loving their eyes in the process so that they can enjoy a lifetime of good vision.
Excellent. And you mentioned children should care their eyes. How can they do so?
So
Explain what are some of the simple things they can do.
There are a number of things that children can do to love their eyes. Number one, they can have a balanced diet. So foods which are green leafy foods, foods which are rich in color, for example, pumpkins, carrots, things like the green leafy vegetables, for example, callaloo. These are rich in vitamin A. And foods which are rich in vitamin A, foods which are rich in minerals and vitamins, other vitamins, they have this protective effect on the eye. So it's recommended that children have these types of healthy foods, and also fish. Fish is also good for the eyes. So it's good for these children to have these types of foods incorporated in their usual diet. Another thing is children need to be encouraged to play outdoors. So in this age of phablets and computers, cell phones, etc., children need to be encouraged not to sit at the phablet or on the phone for long periods of time, because research has shown that children who spend a lot of time on their phablets do eventually develop myopia, which is short-sightedness. So children should be encouraged to play outside, enjoy their childhood. Another thing that children can do to love their eyes would be to ensure that they have a proper night's rest. So children are encouraged to have enough sleep every night so that their eyes can be healthy, and also their general health.
And go ahead.
Yes, other things could be ensuring that children take care of their personal and general hygiene. So things like advising them not to share kerchiefs and rags with others, trying not to rub or touch their eyes frequently. For example, a lot of children, they tend to rub their eyes frequently, and they usually touch a lot of surfaces, touch a lot of people. That's one way that they can contract conjunctivitis. So don't share your towels and your kerchiefs, and wash your hands properly. Basically, taking care of your general hygiene.
And that's important because children will play, they will touch different surfaces, and then they just rub their eyes and
Yes.
they get an infection. But all the things you highlighted there, Dr. Bob Sample, the supervision from adults in the lives of those children, that is extremely important because they're the ones that will ensure that it's done.
Yes.
What advice you have for the parents as it relates to in getting these children to be motivated to eat the vegetables and to stay off of the devices as much as they are doing these days?
Well, children take pattern from adults.
Mhm.
So we as adults need to incorporate those healthy foods in our diet and also eat them so that our children can see that we're eating and they will take pattern from that. That's one. Two, for example, every weekend, take your children out to the national park, to the gardens, so that they can have that outdoor time. We can spend some time maybe reading a book while they run and enjoy their childhood. Those are two ways that we can
Mhm.
have children incorporate these two things in their lifestyle.
Mhm. And I'm sure you would disagree with the method being used by quite a lot of parents of just getting the child to be quiet, give them a device, and put them in a corner. I'm sure you'll disagree with that method.
Yes.
All right, thanks, Dr. Bob Sample. Miss Harry, each year, the Georgetown Public Hospital Corporation, the eye clinic especially, that department will host a number of activities in observance of World Sight Day. This year, what were some of the activities implemented in observance of the day?
This year, both the eye clinic and the vision center at Georgetown Public Hospital, we hosted a educational booth whereby persons were able to step by, come by, stop, learn a bit about the different eye disorders. They could have made appointments to have their eyes screened. We also have a little. We had a little that's the educational task whereby we did some Scrabble, we made some makeshift glasses so that persons were able to put on the glasses and just to see how it is that a patient that has, let's say, glaucoma or diabetic retinopathy would see on a day-to-day basis so that they have a little bit more empathy when dealing with those patients.
Mhm. And it's so important for persons to actually get that experience. And I hope and I trust that it will be a motivation for them to care their eyes. Because only when you're in that situation, having a low vision or impaired vision, then you realize how important your sight is. What was the feedback? Sorry, where was this activity held?
Right at the, right where the pharmacy was, right where the pharmacy is,
Mhm.
right down behind the eye clinic.
In the foyer area.
In the foyer. Okay.
Yeah.
Well, that's as soon as you come in the street entrance.
Yes.
Yes.
Um, all right. Dr. Bob Semple and Ms. Harry, you both can answer this. That's fine. What are some of the services available at the Georgetown Public Hospital Eye Clinic for children? And why I ask is that I'm aware that things have improved significantly. We have more specialists like Dr. Bob Semple and others that are now providing services that were not available, at least when I was young, um, because at that time it was very limited when I was diagnosed with glaucoma. So, Dr. Bob Semple, you probably can start. What are some of the services available to children now as it relates to their eyes?
All right, so starting from the newborn and infancy period, we do screening for babies who may have been born prematurely, or for those who have low birth weight or who have had complications within that newborn infancy period. And we do that every day. That is called retinopathy of prematurity screening and other screening for babies. That's one service offered. The other is for general conditions for children. So children who may have reduced vision, children who may have diagnosis of cataract or glaucoma or on any other eye disease, we routinely see those children at our GPHC eye clinic. Parents, if you notice that your child has any kind of symptom relating to the eyes, you can take them to your primary healthcare provider, any optometrist, any health center, and you can get a referral and you can bring that referral into the Georgetown Public Hospital where we will see your child and be able to identify what issues they may be having with their eyes and then offer management. Another service which is offered at the Georgetown Public Hospital at the Vision Center is the refraction service. Now, Miss Harry would be able to
Yeah.
shed some more light on that.
Hmm. Go ahead, Ms. Harry, if you can speak on the Vision Center and the services offered there, the refraction service.
Not just at the Vision Center at Georgetown Public Hospital, but vision centers across Guyana. We have the Lenora branch, we have Westem, we have Myconi, Diamond, Letem, and Georgian Public Hospital. We also have Luzignan Polyclinic, and we have Enmore Polyclinic. Now, these centers are equipped to conduct a refraction. In some cases, you are actually even able to screen for different diseases. Let's say you have you're a diabetic, and you'd like to have your eyes screened. You can go make an appointment, and you can have that done. For the refraction aspect of it, we do the regular refraction, and for the ones that are a bit more complex, we do cycloplegic refractions as well. In case of persons that need spectacles, the government of Guyana would have introduced a low-cost spectacle initiative, whereby that initiative now helps the general public afford the spectacles. This is something completely different from the spectacle voucher that they would have issued for both the children and the senior citizens.
So this is a new addition.
This has been around since, I believe it was October last year.
Excellent.
All right. So you can come, you can get your spectacle, you can have your eye test done, and you can get your spectacles done at a reduced cost.
Ms. Harry, are you guys seeing an increase in the number of children accessing services at the vision centers over the past few years?
Yes, we are. And not just over the past few years. Let's just take into consideration since the government would have launched this voucher program, we actually had a really large turnout, and we are welcoming that because now we're able to pick up those eye conditions at a very earlier age. Because remember, before we had persons that, okay, I cannot afford an eye test, I don't have the time. So now that the voucher is coming to you, and we have the services spread out across the country, we're seeing a bigger turnout. And we're welcoming it.
And a lot of these children require glasses.
Yes.
Interesting. Dr. Bob Semple, if you can pitch in here. Well, actually, we'll address this when we return from this short break. We'll look at increase in, if there's an increase in diseases based on the increased children accessing services now, if you're seeing an increase in diseases, and what are some of those common conditions. We'll be back after this. We'll take a short break. Stay tuned. Welcome back. You tune in to Disability and You. I'm Ganesh Singh. In observance of World Sight Day, which was observed last Thursday under the theme Children Love Your Eyes, I have with me Dr. Arlene Bob Semple, ophthalmologist at the Georgian Public Hospital, Cooperation, and Ms. Janelle Harry. She's an optometrist at the same institution. Dr. Bob Semple, before we paused for that break, Ms. Harry was highlighting an increase in the number of children accessing services at the vision centers, and that's a result of the program where the government is offering vouchers to conduct eye tests and free spectacles and so on. Have you seen an increase in the number of children being diagnosed with serious eye conditions based on the number or the volume that is accessing services now?
Yes, we have. We have been seeing an increase in the uptake of persons accessing those services, including children.
And you're seeing a lot of referrals to your end, where they come for more in-depth assessment or diagnosis?
I would say so. After the COVID-19 pandemic, we have been seeing a lot more patients accessing the service, including children.
And what are some of the conditions that are most common?
In children?
Yes.
So in children, we see a lot of them with refractive errors. These are eye conditions which can be corrected with glasses. So a lot of them they require the service of refraction, but there are others that would require more than just refraction for the management. For example, patients with congenital cataracts, patients with congenital or juvenile glaucoma, patients who may have retinal detachments or predisposing factors for retinal detachments, young children with traumatic issues to the eye, infections, etc.
And you mentioned management. What is available here in Guyana now? As I highlighted earlier in the program, some years ago, a lot of services that we have now are not available. What do we have access to now as it relates to managing um, when it comes to some of these conditions, the management of these conditions?
All right. So in the past, there was a lot of focus on cataracts and cataract surgery. Now, we've introduced more glaucoma surgeries. That would also include laser procedures for patients who present with glaucoma. Also, we have retinal services. These would include, through the Diabetic Retinopathy Center, screening for patients who are diabetic. And for those who may have certain grades of diabetic retinopathy, we will enroll them in our eye clinic where we can manage them either with laser procedures or with injections within the eye to help with the swelling in the eye, or if it's at an advanced stage, we can do retinal detachment surgeries for diabetics.
And all that is available now,
All of that is available
including
now.
injection, laser, and so forth.
Yes.
Interesting. Um, and I say interesting because just 6 years ago, you had to go private or overseas to get that done.
Yes.
So that's a major achievement for the public health sector. Um, how often children, and either one of you can answer this, should get their eyes tested, and what are some of the signs parents should look for, or adults that are around children, to recognize if they might have an issue with their eyes? Because sometimes we are oblivious to these things, and children will go through many years, even in school, and they have a serious visual impairment. So, what are some of the signs, and how often should children test their eyes?
All right, so in the infancy period, that is within that first year, babies should have their eyes checked at least once. So at least by the 6 month period, they should have had an eye examination to rule out any condition of the eye that may have been present since birth. By the time they are 3 years old, they should have had their second eye exam, and then every year after then. So annually, after 3 years of age. Now, some of the common signs or symptoms that may be present in children to let us know that they have an issue with their eyes are cloudy vision. So children may not come out and say, well, my vision is cloudy. You may notice that they are missing some work in their notes. The teacher might say the child may be squinting their eyes. Things like that we can pay attention to. That's one. Two, you may notice that one eye is larger than the other, or you may notice that one lid is drooping more than the other. You may notice that there is a whiteness in the eye that can either point to the patient having a cataract or some other problem within the back of the eye. So these are just some of the things. Also things like redness and tearing, discharge from the eyes, things like that we can pay attention to.
Mhm. And what about performance in class? And the reason I'm asking this is that many times we blame the lack of performance from a child on their learning ability without ruling out other factors such as sight. Because I work in the blindness services field, and you see many children that we might find that are visually impaired. They suffer in class without the teacher or parent even knowing that it's because of their sight, and they blame it on the learning ability. How or what would you recommend to teachers and parents as it relates to this aspect? If they think that the child performance is not good and this child is not do not have a condition, should they still go and get that eyes tested
They
to rule out
should.
that?
They should. That's one of the first things that they should do. But you could also question your child based on the age of the child. You can try to question them and inquire how clearly they're able to see on the blackboard. Are they sitting at the back of the class? Are they in the front of the class and still missing notes? Look through their notes. See if they're missing anything. Speak with the teacher. The teacher might be able to give some input. Is the teacher noticing that the child is squinting during class, even if they're at the front of the class? Things like that we can pay attention to.
Excellent. Thanks. Ms. Harry, you mentioned a lot more children accessing services and you are prescribing more glasses for children. How do you get them to wear these glasses? And the reason I'm asking is that a lot of children, when they get glasses, just leave them because they don't want to look different from their peers, or they don't want to be called four eyes and all of those things. I've been through that. How do you get them and encourage them to wear these glasses as prescribed?
So for me, when I'm dispensing a frame to a child, I would ask them, "What's your favorite color?"
Mm.
I try to give them options within a color that they like, and you'd be surprised how well children gravitate towards wearing a glasses that is a color that they like.
Mm.
And what we notice now is that a lot of the kids that are coming, even if they don't have an eye disorder, they're telling you, "Oh, mommy, I want the glasses still. I want the glasses.
Yeah.
I want the glasses." So you try different tactics with them. You ensure that the frame that the child would have selected is something that the child wants. Yes, the parent has the final say, but what I tell the parent is that you're not going to be with this child when he or she goes to school. And if you don't want these glasses to be in the bag as soon as you drop them off, you try to give and take with them a little. If it's a frame, and we have a wide selection of kids' frame. And if it's a frame that the child likes, most times the parents goes with it. And the children wear the glasses. They even now, remember first before when you had the strings?
Yes.
Children now want to wear the strings. Yeah.
I used to hate the strings because they made you look so, as you know, wanting for a better word, nerdy. But now
Some
it's good that they want to wear it.
Yeah, some kids actually like the string because they say, "Okay, when I'm going to play, all I have to do is take it off and I could run and put it on back."
Mhm.
Yeah.
So I'm glad to hear that the method that you are using is to let the children like what they wear, so they're more comfortable in wearing it, and then that means they'll wear it
Yes.
rather than giving them something that they really don't like. Um, Dr. Bob Sample, you mentioned earlier that every year children should get their eyes tested, even if they're not at risk. For those who might be at risk, like they have glaucoma in the family or some other hereditary condition, how often should they get their eyes tested?
It still remains once a year.
Once a year.
Yeah.
Mhm.
Of course, when they're going to have that eye exam, the parents of the child needs to mention to the eye care provider, well, we have this condition in our family, so that the eye care provider will have within their mind when they're examining this child, let me look for these signs and symptoms in this child.
Mhm.
Yeah.
And that definitely helps in a big way because the doctors can look for certain things. Anything else to share before we conclude this edition of Disability in You, Dr. Bob Sample, as we observe World Sight Day 2024 under the theme Children Care Your Eyes? And I'm sure, you know, there's a reason why the theme was chosen, and that is because a lot of children now, using devices and screens and so forth, are predisposed to certain eye conditions. So, any final message for parents and children as it relates to caring of the eyes, loving eyes?
Yeah, so in the event that they have to use their tablet, or you just want them to spend some time using a cell phone or a tablet, they need to advise the children every 20 minutes spend about 20 seconds looking somewhere in the distance. Look out in the distance so that your eyes can relax a little, and then you can get back to doing your work. That's in the event that they must use their tablet or cell phone. And in addition to children loving your eyes, which is the theme for this year, adults, we also need to love our eyes, and our lifestyle factors would also play a part, in addition to aging and genetics, in us developing eye conditions. So we all need to love our eyes and take care of them and have them checked at least once every year.
Hmm. And only those who don't have sight know how important sight is.
Yeah.
I can tell you that much. Miss Harry, any final message for parents and children out there as it relates to caring of the eyes?
One message to the parents, the government of Guyana, we have a school screening program that runs throughout the year. We try now to screen children before they get into nursery school, before they get into primary school, and before they go over to the secondary school. We have a lot of schools and we have a lot of children. We are trying our best to see how we can spread out the services throughout Guyana. So what I would advise is that get in contact with your teachers to know when it is that you're going to have that school screening done, and please make your children available for that screening, because from those school screenings we're actually able to pick up that a lot of kids have what is called amblyopia, and if it's picked up too late, there is only so much that can be done.
And could you explain quickly that condition?
Okay. So amblyopia is how it happens is that, let's say a part of the eye, it's weird.
So in amblyopia, that's basically when the vision is reduced for some reason or the other. Either the patient has a cataract in the eye, or they have a refractive error that has not been attended to in the early stages, and so there is no good development of the visual pathways, and so the patient has reduced vision in that eye, something that could have been corrected in the past, but it was not dealt with at that initial point, and so they've basically have reduction in their vision as a result of that.
So the eye gets lazy, and due to that laziness, the glasses doesn't give much of a assistance at that point.
And I'm happy that there is a comprehensive program to screen in schools. And that would also help if that child needs low vision services to help in the learning process, such as magnifiers and screen reading softwares and so forth.
Yes.
But that's for the education system, which I'll definitely discuss on a subsequent program. So Dr. Bob Semple, Ms. Harry, I want to thank you both for sharing with us as we observe World Sight Day 2024. And I also want to thank you for the work that you're doing in the field of eye health to ensure that the children and even adults can be able to access much improved services now in Guyana. Thank you very much.
Thank you very
You're
much
welcome.
for having us.
Thank you very much. And that was another edition of Disability in You. Remember, disability rights are human rights. I'll be back with you next time. Goodbye.